Good afternoon. As many of you are aware, Baton Rouge has struggled with high case rates of HIV and AIDS for decades. People of all backgrounds, ethnicities, and socioeconomic status are affected by the infection. The greatest challenge in addressing this public health crisis is the stigma surrounding HIV and AIDS. My administration, as well as organizations like those who stand with me today, have been hard at work to address the HIV epidemic in our community. Now, in 2017, I joined mayors from around the world by signing the Paris Declaration, making Baton Rouge a fast-track city, which means I pledged to get 90% of our citizens to know their status, 90% of people who are living with HIV to receive treatment, and 90% of our people in treatment to have a lower viral load. And today I am truly overjoyed to announce the findings in the Center for Disease Control's HIV surveillance report. The report shows that Baton Rouge has made significant advances in our work with HIV and AIDS. Because of increased testing, Baton Rouge's rankings for AIDS diagnosis have seen a dramatic decrease. In 2016, Baton Rouge was ranked #1 in the country for AIDS diagnosis rate. And I will tell you that has been troubling not only for me, but for many in our community. But since then, we have cut the diagnosis rate nearly in half and are now ranked #10. Since taking office, I have collaborated with the organizations you see behind me to increase the amount of testing in Baton Rouge. In 2016, they performed more than 18,000 HIV tests. In 2018, we almost doubled the amount of tests to more than 33,000. To achieve the higher rate of testing, we implemented a new method known as opt-out testing. Whenever a person goes to an emergency room in an area hospital, they are automatically tested for HIV unless they specifically ask not to be. Each year we have increased these numbers thanks to our partners like the Baton Rouge AIDS Society, Care South, Capital Area Reentry Program, Family Services of Greater Baton Rouge, Metro Health, Open Health, and Volunteers of America. Ochsner, Women's Hospital, and Our Lady of the Lake have all come together to provide opt-out testing in their ERs thanks to the support of the Department of Health and Gilead's Focus Initiative. Sam Burgess, Director of the STD HIV Hepatitis Program for the Louisiana Department of Health, will now talk a little bit more about this effort from a public health perspective. Sam?
Good afternoon. Thank you, Mayor. I'm Sam Burgess, Director of the STD HIV Hepatitis Program with the Louisiana Department of Health, Office of Public Health. I and my colleagues at the Health Department are incredibly proud to stand along with the Mayor's Office and other partners here in Baton Rouge to celebrate the news that the Mayor just gave us, as well as the fact that we're looking at one of the lowest numbers of new HIV diagnoses in our state since the epidemic began in the 1980s. In addition, we've seen steady improvements in reducing late testing for HIV, increased linkage to care when someone's diagnosed with HIV, and we've also witnessed the ability of people living with HIV to achieve and maintain viral suppression greatly improve over recent years, statewide as well as here in Baton Rouge. The City of Baton Rouge, the Rhine-White Part A program, the Mayor's Healthy City Initiative, the Region 2 Office of Public Health, people living with HIV, and the many community-based organizations, hospitals, and clinics are deserving of the credit and all of our praise for these differences in HIV rates we're seeing today. I want to thank you all for your passion and your enduring efforts to address HIV in our state and specifically here in Baton Rouge. It's clear that together we can and will bring an end to this epidemic. Thank you.
Thank you so much, Sam. It was my goal to increase HIV awareness so that people living with HIV can protect themselves and their loved ones. And so we are meeting that goal through increased testing. I will tell you, before entering office, I felt that there needed to be an elevated awareness around what was taking place in our community. While we had all of these great partners doing the work, unfortunately the stigma prevented this from being a discussion that many had throughout our community. Scott Wester, the CEO of Our Lady of the Lake, will now talk more about this initiative and how over the past 3 years they have tripled the number of people getting tested in their facilities. Scott?
Thank you, Mayor. Thank you all for coming out today, and welcome to our North Baton Rouge emergency room and our urgent care, which also has seen a lot of progress over the last couple of years. We've been working on the epidemic of HIV and AIDS really since the 1980s, when our sisters established the first housing option for a person living with the disease. That house is still in existence, called the St. Anthony's House, and still does a tremendous amount of work within the community. Thanks to the support of so many, we made great strides in the fight to eliminate HIV and AIDS in the recent years. Of course, one of those, as the Mayor has called out, has been the opt-out HIV testing at all of our emergency rooms in conjunction with Ochsner and some of our other institutions. When we talked with the Centers of Disease Control a couple of years ago, we asked them, what are the things we as a community should be really doing to really reduce the incidence of HIV? And they really claimed, the number one thing you need to do is to continue to test more frequently. And that's when we decided to do the opt-out, which means that if you come into any of our emergency rooms, you will be getting an HIV test unless you decide not to. And you saw some of the statistics about the growth we've had and the testing we've done. The CDC data and report shows that what we can accomplish as a community when we set our sights on an issue and resolve it to address it together. I really thank Jared, Colette Barrett, and all those who are working with our Mayor's Healthy City initiative. This was one of our key issues we've been working together throughout all of our community hospitals through the Mayor's Healthy City initiative. We continue to this work and also the community, and we continue to make sure we go from number 10 to number 15 and further down the list. So thank you very much.
Thank you so much, Scott. Through increasing testing, helping people get into treatment, and raising awareness of available medication, we can begin to see an end to this epidemic. We have to come together to advocate for those affected and to educate people in our community about HIV and AIDS. And I've said time and time again, the first step to stopping the HIV epidemic in Baton Rouge is awareness. And a large part of becoming aware is getting tested. The earlier you know, the faster our medical and social services can help. I now would like to introduce someone who's been on the battlefield for a long time in community health care, and that's Shirley Lolis, Executive Director of Metro Health. Shirley?
Thank you, Mayor. I'm so excited. It has been a long time coming, since 1988, fighting to reduce the spread of HIV, getting people connected to services, educating our community, letting them know that this is a disease that we need to make an impact so that we can prevent this spread for the future generations. These statistics say we can do this. Prevention and treatment goes together. Some say prevention is treatment. Testing is very, very, very important. But that's just one step. As the Mayor said, linking them into services, connecting them, making sure that persons who test positive has someone to help them navigate the system. We will continue, Metro Health, HART, and the other organizations that you see here, to not only educate our community, offer services, offer supportive services, so that we can end this epidemic together. I'd just like to say thank you, Mayor, for making HIV a priority with the Healthy City Initiative. This has not been that we see, and your compassion with your administration that has. And I just want to say, I just look forward for it to get better and better, because the state and the city are joining together to end this epidemic. Thank you.
Thank you, Shirley. Regular testing for HIV is reducing the rates of AIDS diagnosis in Baton Rouge. Community health centers, hospitals, colleges, and my administration push for Baton Rouge residents to get tested. All the testing has actually contributed to an increase in our HIV diagnosis rate. This is a good thing, as you've heard, because people who know their status are more likely to get treatment. This is a big reason why our AIDS diagnosis rate has been cut nearly in half. I'd like to introduce you now to the Louisiana Department of Health's lead community health worker, Isaac Gilliard. Isaac.
Thank you, Mayor. I am Isaac Gilliard III, and I have been living with HIV since 2005. I, along with 4 diverse individuals, make up a team of community health workers working towards addressing the barriers and stigmas that contribute to HIV, while using some of the same resources that I started to receive in 2005 through 3 pillars, 3 strategies: diagnose, retest, and screen for hepatitis C, HIV, and syphilis. For those individuals living with HIV, to treat, we link them to medical care, and for those not living with HIV, hepatitis C, or syphilis, we refer them to prevention strategies like PrEP or SSPs, which are known as syringe service programs, to provide access to clean needles for people who use needles to inject drugs. Thank you.
Thank you, Isaac. You see, when people seek care, they're more likely to lead healthier lives, and it's crucial that we continue to push for HIV awareness. The CDC's report is definitely worth celebrating. Just a few years ago, as you know, Baton Rouge was ranked #1 in the country for AIDS diagnosis rates. Today, we've cut those numbers in half, and we're ranked #10. This is a huge achievement, but it also serves to remind us that there is much work to be done yet in our community. But through the power of advocacy and education, through the collaboration that you see here today, we can lower the stigma and change Baton Rouge for the better. Thank you so much, all of you all, for your work and for your continued commitment to a healthier Baton Rouge. Thank you, and we'll take any questions that you might have.
You said that there's much work to be done still. I'm just curious, following this announcement, sort of what going forward do you think the city needs to continue with this?
Well, I will add, and I'll welcome any of our partners to add as well. I would say that we are on the right path in terms of our procedures of what we're doing with the testing. So obviously we would need to increase those efforts that we're doing. We're on the right path. We've got, our plan is working, so we just increase and intensify what we're doing. Would anybody else like to contribute towards that?
I would make one other comment too, and I know we have Dr. Griffin, the new CEO of Women's. Women's has done a remarkable job.
Step up to the mics, please.
Women's has done a remarkable job over the last decade plus of really reducing the transmission rates for those that are the newborns. And we have the pediatric infectious disease physician within Our Lady of the Lake. We've had 1 child over the last 5 years who has had a transmission as a newborn with HIV. Historically, that was about 5 to 6 per year. So that's almost been eradicated in the community, which is really a testament of our caregivers.
And I'll just add that at Women's Hospital since 2005, we've had this program in place, and we've been able to reduce the transmission rate from 40% down to less than 2. We've not had a baby born at Women's since 2005, turned out to be
Has there been any research done as to why we were number one? I mean, just from Shreveport but coming to Baton Rouge, it's kind of startling that we were number one in the country here in Baton Rouge.
So I'm going to defer that to the group behind me. As you know, I am very
I'll start, and I will say that one of the reasons we were number one was because there was a lack of discussion, awareness. It was like we talked about throughout my comments, the stigma. Because there was a stigma, people, I feel that there was not the intense level of addressing it, of talking about it, of elevating awareness about it. And so with HIV and AIDS, there's no reason it should not be a part of the discussion when we talk about the fabric of our, and the health fabric, if you will, of our community. But unfortunately, I believe that the level of communication, awareness to the community was not there. I will tell you that the collaboration, I believe, is strengthening day by day of our providers and our resources, and so I think that's very important. Jared, did you want to add something?
So my name is Jared Hemowitz. I'm the director of Mayor Ruth's Healthy City Initiative. I think one thing to answer your question directly is kind of where do we go from here? We're really fortunate that the city of Baton Rouge received a CDC grant to do more planning around ending the HIV epidemic. And for the first time ever in Baton Rouge, we have a full-time staff person that's focusing on this effort. So Mathilde Silverberg is going to be focusing on bringing a coalition of partners together, strategizing, and helping to take this one step further.
I have a quick question. I know we were talking about testing, but PrEP, I know that's a really big deal and people using that. Did that have any effect at all in lowering this number?
Yeah, absolutely. And I think also just the revelation that people living with HIV, once they become virally suppressed, aren't able to transmit HIV to their sex partners any longer. That development in the science and news has really empowered our people living with HIV as well as our folks doing the work here. But PrEP and treatment as prevention have played huge roles in these improvements that we see today.
One more question. How do we make sure that people who might be lower income can access that? Because everybody might not be able to get PrEP.
So there are, well, in some of the first clinics that offer PrEP in Louisiana or in the room today, Open Healthcare Clinic in particular and Care South, both large volume PrEP providers in our communities. They offer services to individuals on sliding scale fees. And we also operate a statewide teleprep program through the Office of Public Health, which can provide that service to individuals no matter where they're located in the state.
I call last question unless anyone's got anything in depth.
Thank you all for coming out today.
Thank you.
And thank you all.
Thank you.